Hi guys, welcome to my channel. My name is Isabella. If you're new here, just so you know a little bit about me, I had a weight loss surgery back in August of 2020. So it's been about 5 months and I've lost a little bit over 70 pounds so far. So in today's video, I'm going to be talking about some things I wish I knew before I got a gastric sleeve. And these things are like good and bad, you know, there's some good ones, some bad ones, you know, it's all over the place. But regardless, they would have not changed my decision in getting the surgery. It would have just been good to know these before getting the surgery. So I have my phone here because I am very forgetful, especially when I'm filming, so I have a list of things on here. So yeah, the first thing I wish I knew about the surgery is that it would be completely life-changing. Like, I wish I knew the extent of how much it was going to change my life. Like, not only has it changed me physically, it has changed me literally in every way, and it's not bad by any means. It was just such like a quick change that I wasn't really ready for, but it's been really good. It just would have been nice to be given like a little bit of a heads up, but it's been amazing so far. The next one is kind of stupid, I guess we could say, because the whole point of the surgery is to make your stomach small so you eat very small portions. But what I wish I knew before getting the surgery is how small the portions were gonna be. Like, I knew that I was gonna eat a lot less, but I didn't know I was gonna be eating so much less from what I was eating before, if that makes sense. I remember when I was doing my pre-op diet, which consisted of only one meal a day, I was eating the Life Cuisine meal that you put in the microwave and it's ready. And it would come in like a little dish, and I remember eating that and complaining every single day like how little this was and how I wish I could eat more. And my mom would tell me, you're not gonna be able to eat more than that when you have the surgery. And I was like, yeah, right. And honestly, if you put one of those dishes in front of me, I would probably be able to finish a quarter of it. That's how small I eat. And another thing I wish I knew was that your appetite definitely changes. Like, before surgery, I had such a sweet tooth, and I still do, but it's a lot less than what it was before. Before I could eat sweets all day long, and now I'm like, with one piece of chocolate, I am tired of sweets and I'm fed up. I remember for my pre-op diet, I had to drink a lot of protein shakes as well, and one of my favorite ones was from Quest, and it was a salted caramel one, and it was my favorite one because it was so sweet. And I remember when I got home from the hospital and I drank that same protein shake, I almost threw up because of how sweet it was. Your appetite and your taste really does change a lot. I would have also liked to know that I cannot eat certain things, or that certain things make me feel bad. Like before, like any regular person that doesn't have any medical issues or anything, I could eat whatever I wanted, and honestly nothing would really make me feel sick. And now, like I said in my previous video, carbs make me feel so sick. Not so sick, but it makes me feel bad. It makes my stomach feel heavy. It makes me nauseous sometimes even. And before, I could eat a whole pizza in one sitting and just feel full but not really feel bad. And now I eat like 3 bites of a pizza and I feel sick. Another thing that I wish I knew was that this surgery is harder mentally than it is physically. And this is something I also talked about in my previous video. This surgery is definitely harder mentally than it is physically by far. Even if I explain it to the best of my abilities, I don't think anybody would understand what I'm saying except those who have had a weight loss surgery. The reason why it's so hard mentally, at least the reason why it was for me, is because you literally go from one day to the other. You eat whatever you want, you eat however much. You do have the pre-op diet, so you kind of get adjusted to it a little bit, but it doesn't do that much. But you still eat whatever you want. You can drink as much as you want. To now eating so small. You can't drink however much you want. Really wish I knew that I would have to change my eating habits, and I feel like this is something that I was told, but I wasn't really explained it exactly, if that makes sense. You really do have to change your eating habits. Obviously your portions, that's a given, but you can't gulp any drinks. You have to eat very slowly, and if you don't eat slowly, your stomach starts hurting. You can't eat or drink within 30 minutes of each other. Like, you can't eat 30 minutes before or after drinking, and you can't drink 30 minutes before or after eating. It's a lot of things that you have to remember and get adjusted to, and at first it's hard because you're used to eating, you know, however you want, and now you kind of have to follow this guideline, if that makes sense, which is hard at first, and honestly it still is, but you get used to it a little bit as time goes on. Another thing that I wish I knew, and this one is good, I guess, is that I lose weight so much quicker than I thought. When I found out I was gonna be getting the surgery, I was still kind of down because my mindset was, okay, like maybe in a year and a half I'll be skinny. But I've lost 70 pounds in 5 months. I don't know what I was thinking before, but you lose weight so quickly with the surgery, which is something that I honestly wasn't expecting, but I'm not complaining. Something else I wish I knew is that due to the lack of nutrients I am eating or receiving, I get some side effects. The two most annoying ones being, one, I get tired so quickly. Like, I feel like if a normal person does something that's physically hard, okay, they may be out of breath for a couple minutes, but me, depending on what it is, I will probably be out of breath for a couple hours. It happens, and it's happened before. It happened to me earlier this week, and I feel that's just because I don't get enough protein in, so I'm working on that, but that's definitely something really annoying. And the second thing is my hair, and this I knew was gonna happen. What I wish I did was take it more seriously before my surgery, because I knew that my hair was gonna fall. I didn't know to this extent either, but I wish that I would have taken it more seriously and would have taken pills for it. I think you can take collagen or biotin for your hair, which I heard it does help with people that have gotten the surgery, but I feel like if I would have taken those pills before my surgery and taken them responsibly and on time and every day, my hair wouldn't be falling out as much as it is now. But you live and you learn. That's my tip. Please take your biotin or collagen pills, whatever hair growth pills you have. And another one, which is more so a tip, is I wish I would have taken more pictures of how I was before. You know, before I was very self-conscious and insecure, and I didn't want pictures of myself or videos, so I have a very limited amount of pictures and pretty much no videos at all, which honestly sucks because I want to see the difference. I want to see the before and after. I wish I would have face-tuned all my pictures, or most of them. I wish I would have taken more videos. That's why if you see me on TikTok posting before and after pictures from, you know, trying to go TikTok viral, they're always the same before pictures because I cannot find anymore. That's literally all I have, which sucks. So if you're thinking of getting the surgery, or maybe you just want to lose weight with or without the surgery, take some before pictures. Trust me, you will thank me for it later. And last but definitely not least is, and I think it ties back to the first one I said, is that I would change completely as a person. I said earlier, I think, I really thought that, okay, I'm gonna get this surgery, I'm gonna lose weight, and that's gonna be it. But no, like, yeah, I've lost weight, but there's been such a huge change mentally, emotionally, like in my personality, and that's something I was not expecting at all. By no means is that bad. It's been amazing, it's been great, but it's just crazy that no one really tells you about that. Like, all you hear about is you're gonna lose weight and you're gonna feel great and that's it, but like, you're gonna do a complete 180. You're gonna change entirely. At least I did. I changed so much. Like, I look at pictures of myself before and I'm like, who is that girl? Like, that's not me. But it is. I've just changed that much. But whatever surprises I may get, whatever good there is, whatever bad there is, I would not go back on this decision. If I could, I wouldn't, because it's been the best decision I've made in my life so far. It's made me happier, it's made me kinder, it's made me overall just a better person, honestly. I definitely know this video would have been great to see when I was in my pre-op process. I hope you enjoyed this video, and I hope that you subscribe and stick along to watch me on my journey. And I also hope that you join me on my Instagram, because I post a little bit too much on there sometimes. I am always posting on there, so I hope you follow me on there as well. And if you have any ideas, any suggestions as to what videos I should make next, let me know. And if you have any questions, feel free to DM me on Instagram. I'm always answering DMs on there. And yeah, I hope you stick around for the next video. Bye.